Hi, good evening, everyone. Welcome to She Built It Boss Lady Chronicles. I am Sherita Gaskins-Tillett. I am your host, and this is the show where we feature the amazing stories of women who are owning their power to transform their lives and, by extension, the lives of other people. I'm really excited about tonight's guest because we have been trying to connect for a really long time. So I'm so happy to finally have her here with me tonight. But before we get started, I just want to give a couple minutes for folks to log on. If you are watching us live, please say hi in the comments, put your questions in the comments. If you are watching the replay, hashtag replay, I still invite you to put your questions in the comments because I am happy to pass them on and I am certain that she is happy to answer them. Also, I just want to remind you that registration is still open for a weekend for me, the premier wellness experience for professional women. This year, we are going back to Grand Cayman. So we're going to be in Grand Cayman October 2nd through the 5th. We would love to have you with us. It is an absolutely fabulous, transformational experience, and Grand Cayman is gorgeous. So without further ado, I am going to introduce our guest. So I have joining me tonight Dr. Kweli Carson. Dr. Kweli, the anti-burnout coach, is a best-selling author and transformational coach who helps high-achieving professional women go from burnout to balance by aligning their lives with what truly matters. A former endodontist who experienced severe burnout herself, Dr. Kweli now uses her expertise, empathy, and signature anti-burnout plan to guide women toward lives filled with purpose, peace, and fulfillment. She is the author of the #1 Amazon bestseller, The Ultimate Self-Love Guide for Black Women, a powerful invitation for women to offer themselves the same care and compassion they so often extend to others. Her mission is to empower women to thrive, both personally and professionally, without sacrificing their well-being. Welcome, Dr. Kweli.
Thank you so much for having me, Dr. Sharita.
Well,
And
I am
it
so
has
happy
been
because I know I'm
a
really
while
happy to
for
have
us.
you here because we have been trying to connect for a very long time. And so, like I said, I'm super excited. I love what you do. I love the book. Certainly I love the work. And so, I just wanted to have you here so that we could learn more about you, more about what makes you tick, and hopefully get some really good tips and advice. So, I usually like to start by asking about your journey. So did you always want to be a dentist? How did you come to become a dentist? And then, what kind of caused your shift?
Thank you so much for having me. Me wanting to be a dentist started when I was in high school. So, I was one of those rare kids that chose a career at age like 15. I got braces. It changed my life really because I just kind of came out of my shell. I used to walk around like this, and then
Mhm.
suddenly I was just showing off my teeth. So smiling and talking a lot, and so I thought I wanted to be an orthodontist and do braces. And I just kind of put the blinders on. I went to my guidance counselor, found out what I needed to do, and just got on the path. Got all the way to dental school, took my first orthodontics class, and realized I didn't like it.
Okay.
So it was more physics, and I was really a biology kid.
Okay.
So I was like, okay, well, I'm all the way here. I let me look at some other things, and so I ended up um, having a really great experience in our emergency clinic in Baltimore at the University of Maryland, where this gentleman came in and he was in all this pain. And I did a root canal, and he left and said, "I'm going to name my first child after you."
Oh, wow.
So that was really cool. Like, I
Yeah.
could use my hands to relieve someone's pain. I mean, I still think that that part of it is really cool. So then I said, well, maybe I'll be an endodontist, a root canal specialist. I applied. I did not get in my first time around. It was very, very competitive back in the day. I applied again. I got in, and then I just once again got on the path, checking all the boxes, doing what I need to do. and then became an endodontist, and then later became a board certified endodontist, which at that time, I think there were literally less than a handful of Black women board certified endodontists in the world. So that was, if you're going to do it, you're going to
Right,
just
right.
go all the way.
So you're a unicorn. So I'm a medical doctor, so I don't know a lot about the dental paths. So so you mentioned that you had to apply to be and to go into endodontist or whatever it is, right? You had to apply to be an endodontist. So how did that work? Is it like a residency kind of
It
thing?
is.
Okay.
It
How
is.
long is the training?
Like similar to medical school, you do the 4 years of college, and then we do 4 years of dental school. And then I did an additional 3 years.
Okay.
It could have been 2 years, but I wanted to get a master's degree also. My husband was in pharmacy school. We were at the University of Iowa. So I was there and I was like, he's going to be here for 5 years. I'll do the 3-year program and get the master's along the way. So did that, completed it. We had our baby while we were in Iowa City, which you could have never told me we would do that. And then came back home. We're both from Maryland. So I practiced there for a couple of years while he finished up pharmacy school. And then we moved back home.
Okay. Now I know just from knowing you and from I don't know if it was in your bio or not that you had your own dental practice. So,
Mm-hmm.
so talk us through that a little bit and what was that like? And I'm always curious, for women especially who have the nerve, the audacity, if you will, to start your own practice. What was that like? Who were your role models? Did you know anybody who was a dentist? Did you know anybody who had their own practice before you went to dental school?
So before going to dental school, I worked with my orthodontist just for a summer, and then I did what now kids call a gap year. But between going to Spelman and going to dental school, I went to Howard University, took some classes, and I worked for 1 year in a general dentist's office. So he was a mentor to me. Having that experience, I knew I did not want to be a general dentist
Okay.
because I knew that I was overwhelmed by the number of procedures that we would do in one day. He would start off with a root canal, and then it was an extraction, a crown, a denture. And I just wanted to be like
Okay.
focused on one thing and be really excellent at doing one thing. So I knew I was going to specialize. But so he was a mentor to me. I also worked for a couple years in Iowa in an endodontics practice while my husband was finishing school. So I kind of knew the inner workings of that practice. And then when we moved back here, I practiced with one of my classmates for, I don't know how many years that was, but a few years before deciding that, oh, I want to have my own dream practice with my like a feminine touch. I wanted to smell good and be pretty and all the things. So I did have some idea of what to expect, but I have to tell you, it was more than a notion.
Okay.
It was more than what I thought.
So were you able to build your dream? Were you able to physically build the practice that you envisioned?
I did. I did. It was literally a pile of dirt, like the building wasn't even there. So I went through the whole construction process. I was like a project manager. I went through all the hiring of my team, all the things, all the equipment installation, even like the sprinklers. I would come in and I said, nope, you can't put that sprinkler right there because my light is going to be there. Like it was just a whole
Yeah.
huge project. But at the end, it was beautiful. It was just what I wanted. It was actually more beautiful than what I had planned.
Hmm.
And I hired really great people. So I had a great culture, all the things that I wanted, but I was working myself into the ground.
Okay, so before we get to the working yourself into the ground, because this is something that we don't do. We as women don't take time to celebrate. So I want to celebrate the fact that you build exactly what you envisioned and that it turned out better than that. And I want to ask you, what did that feel like? To actually see it in real life. What did that feel like?
Thank you. Thank you for saying that. And thank you for asking that. I have to say, I was so excited at the beginning. And it felt exhilarating. And I was really proud of myself. My daughter was watching all of this. I was taking her, poor thing. I was taking her everywhere. So we literally went and picked a rock out of the ground before the place was even built, just to say, like, this is it. This is where we're starting with dirt. And
Hmm.
she watched it. So it was really beautiful. I mean, I'm glad you asked me that because sometimes we do need to be
Yeah,
reminded,
yeah,
y-
because
you
it was
know,
good. There was good there before there was the other. So
that's right.
let's
That's
pause. Let's pause and celebrate that.
And I don't regret any experiences that I've had in my life, really. I'm glad I did it. If I had never done it, I would have always been wondering, you know, oh my gosh, I wonder what would have happened if I did it. So I'm really glad I did it. I created my dream practice.
Yeah, I would also think that that would be very empowering, because the more we do, the more we're able to do, I think. And just
Yes.
knowing that you were able to create that had to have given you some sense of, well, if I could do this, I wonder what else I can do.
And do hard things, right?
Yes, yes,
I can
yes.
do hard things.
All right. So you built this beautiful practice, but it began to be a lot. So tell us what happened.
Okay, so the first thing I should say is I was doing root canals all day.
Okay.
Okay, so we cannot minimize that. Like, I'm literally dealing with patients who are anxious and in pain all day, and I'm an empath.
Yes, that's
So
hard.
I'm feeling like I'm absorbing all of this energy. So that's just one piece of the puzzle, taking care of the patients. Also, I'm managing my staff. So hiring, firing, oh, these two people shouldn't work on this together, those kinds of things. I also, because I'm a specialist, need to have referring dentists. And so I have
In your
to
spare
do a lot
time,
of
right?
marketing. So I'm out, visiting dentists, taking brownies and donuts and all other unhealthy treats that are not good for a dentist to eat. But so all of these things are going on. And around probably year 5, I start seeing the exhaustion is happening.
Hmm.
Like, I'm feeling like I'm starting to break down. And then I started actually experiencing some health issues. So, all my life I had had low blood pressure. And I remember I was standing in my kitchen. I was here at home, standing in the kitchen, and I just felt horrible all of a sudden. Like, I just was like, something is wrong. My husband took me to the ER, and I was dehydrated and had extremely high blood pressure. So that happened. Then I started having numbness on the left side of my body because I had a pinched nerve. Then I was having focus and memory issues because I found out I had hyperparathyroidism. So my body is just starting to, like, break down. Then I started having panic attacks in my office.
Oh, wow.
And I would, like, leave the office and go to my car, and I'd be hyperventilating because I didn't want my patients and my staff to see me, looking crazy. So I'm watching myself just deteriorating. And I'm just like, this is not sustainable.
So how did you know that did you know that it was because of burnout or because of stress from the job, or did you initially think that there was some underlying medical thing going on?
So I connected, that I was really, really stressed out. I remember thinking in the beginning that the things that I was handling at the end, that there was no way I would have been able to manage all of that at the beginning. I used to say, like, if this was happening in the beginning, I would have been laid out on the floor somewhere.
Mm-hmm.
But
Okay.
it just was constant stress. It never stopped. Even if I
Okay.
was on vacation, it was constantly in my mind. So I connected it to stress. I didn't know that I was burned out. I didn't know what burnout
Sure.
was. I didn't know like the definition. Now I'm like the poster child. I was the poster child for burnout, but so I kind of connected it. I started connecting it to like, oh, I'm really, really stressed out. And I felt like I was just, you used the word zombie earlier before we got on the call, but I felt like
Yeah.
I was just a zombie, just kind of going through the motions like Groundhog's Day, just
Mm-hmm.
repeating the same thing. Like I wasn't really, I was almost in a haze of
Autopilot.
just,
That's what I call it.
mhm,
Autopilot.
yep, yep. So I think I did after a while start to make that connection.
Okay. And so once you made the connection, what did you do? Like, what was the process like?
Initially, and probably for another, year or two, I just said, I'm going to power through it because in my mind, failure isn't an option. And we have put all of this money and blood, sweat, and tears into this practice. So I'm going to make it work. And then it got to the point where I was just like, this is not sustainable. Like I'm going to kill myself.
Okay.
Not like,
Yeah. No, no,
uh,
no. Like the stress was going to, I
this
got
is
it.
going to kill me.
Yeah. Yeah.
And I remember I had a conversation. It was starting to, let me mention this too. I tried different things. So I hired associates. I
Okay.
was like, okay, well, maybe I'll get somebody else to come in and help. And the last straw was I hired an associate and then she had a medical emergency and she never came back to work.
Mm.
So now I've built the practice up enough for 2 doctors. And now she's gone and there's
And
one
so you're
doctor
one
and it's
doctor.
me.
Yeah. Yeah.
And so when I got to that point, I was like, oh my gosh, what am I going to do? And I remember having a conversation with two of my best friends from Spelman. They're both attorneys because I was thinking about my options. And one of them said to me, what do you want? Like, do
Mm.
you want to double down and, really just do whatever it takes to make this happen? And that was the first time I was like, what do I want?
Okay, so I have to stop. I got to stop you there too, because that's another really huge thing that, because we're programmed to just go, 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 go. We're on our trajectory, whatever our professional path is.
Hmm.
But once we're on that path, we think we have to stay on that path, like for the rest of our days. And we don't
Exactly.
stop to ask ourselves, what do I want? And even more important than that, we don't stop to ask ourselves, what do I need?
Yes.
Yeah.
Yes. So it's so interesting you say that because as the anti-burnout coach, this is one of the first things I do with my clients. Like, values, what's important to you? Vision, what do you actually want? And a lot of them, this is the first time that they're like I
Yeah.
was, that they're really taking the time to consider this, which is
Yes.
kind of wild if you really think about it. But that's what happened. She asked me, and I said, okay, I guess I have some power here. I have some
Yes.
options.
That part.
And I remember after that conversation talking to my husband, and just because I was thinking, oh my gosh, we have put everything into this, all of our time, money, energy, everything. And he said, yeah, we can't keep, you can't keep living like this. And I was like, oh, okay. So this is really affecting everyone already.
Yes.
So at that point, we just started looking at, okay, well, what can we do? And it was a mess. It was not pretty. It was not tied up in a bow. I didn't sell and do all the things. I literally closed the practice. And then I had surgery almost right after that for my parathyroid, um, physical therapy for for the numbness, and so I closed. Um, Huge financial fallout, very embarrassing. Felt a lot of shame. It was a really horrible time, but it ended up being the best thing I could have ever done.
Mhm.
Um, I ended up going to work as an associate again for another practice. And even though I was still, doing the back to back root canals, that's all I had to do.
Right, right.
I could leave work and come home. And it was a good time because my daughter at that time was in high school. So it was time to start going on college tours. So I could go, I could be present with her. And I only had couple more years before she
Yeah,
was off.
yeah.
She went to Spelman too. So she was off to Spelman. So it all ended up working out well. And then after that, I decided I actually want to phase completely out of clinical dentistry.
Okay.
And so I started looking for some other things to do.
So what made you think of that as an option, really? Because again, we get on our path and we think we have to stay there. So did you know other people who had transitioned out of clinical dentistry, or what was it that kind of made you decide that that was the next step for you?
I just knew that, you know, doing root canals all day, not only is it emotionally taxing, it's actually physically taxing too. So I knew that I wouldn't be able to do it, until I was 60 years old. So I think I did it all together for about 20 years.
Okay.
So I knew I didn't have a whole lot of a whole lot of years left in me.
Okay.
So I just started thinking about what do I want to do when I'm no longer doing root canals.
Hmm.
And an opportunity occurred where someone came into the office and they said, "We're looking for an expert witness for the dental board." And they needed specifically a board certified endodontist in the state of Maryland. And I said, "Oh,
That's me.
okay, let me try that."
Okay.
And I loved it. I loved working from home. I loved using my dental expertise, but while being in my pajamas, you
Right.
know, it's kind of detective work. So I was like, oh man, but it wasn't enough. It wasn't enough work. It was just like really super part time. Like,
Okay.
so I said, well, I can't make a career out of this, but it opened my mind to the idea of,
Yes.
oh, I can work from home. A dentist can work from home. I never really thought too much about this.
Right.
And then I actually started going to a lot of seminars for physicians who had
Hmm.
um, transitioned out of clinical. So a lot of my non-clinical mentors were actually physicians. I did end up meeting a couple of dentists along the way, but I just really had to kind of chart my own course. Is that right? Chart
Yes.
my course or
No,
my
you're right. You're right, because we're like a subculture. Like, those of us who are trained clinically, who work non-clinical, we're a whole subculture that most people hardly know exists until you're in it.
yes, yes. So I ended up mentioning to a friend of mine, oh man, I'm enjoying working from home. She mentioned an opportunity for a dental consultant. And I actually, when COVID hit, started working in that opportunity. And then a couple more people needed specifically a board certified endodontist. And so I ended up getting some various contracts over the years. And once COVID hit and all the dental offices closed down, I never went back to my clinical work. I've
Mhm.
been working from home since 2020 and love it. I
Wonderful.
absolutely love working from home. And working from home allowed me to have all this time with myself. Now my daughter's off in college. We have an empty nest. And I started, I just had this mental space, and that's where I started writing the book, became a certified coach. And now I'm just kind of deciding what I want to do as it's presented to me.
So they say that you are best qualified to help the person you used to be. And
Yes.
so I think that, when I think about you and I think about your journey, that phrase really comes to life.
Hmm. Yes, and I don't work just with dentists. I've had a handful of dentists. But anyone who
I was speaking
is
more to the burnout piece, not so much the dentist,
oh,
but just that were a burned out professional.
yes, yes. And now I've created you mentioned it earlier, the anti-burnout plan. So I actually have a framework that I take folks through. And so it's just really, really incredible that I get to do this work, and very rewarding. It's been This has been the most fulfilling 5 years of my life professionally. Like this, I'm just amazed that I am waking up doing this.
That's
All of
awesome.
it.
That's awesome. And what I love about it is it's not something that you planned. It's just you just kept following the breadcrumbs, right? So one thing led
Yes.
to the next thing, which led to the next thing. And that's something else that we don't, we get afraid to step out on faith or step out into the next place. But there's so much out there, right? That you can't possibly conceive of. You never know what's coming. Like you had
That's
no
right.
idea that somebody was going to walk in needing a Maryland board certified endodontist, right? For
Exactly.
non-clinical work. No idea. But if you had stayed in your practice, there's a good chance that never would have happened.
That's
And
right.
even if it had, you wouldn't have been in a position to accept it. And so it's important that we give ourselves permission to explore. That we don't have to,
Yes.
how is it that they say it? That there are a lot of we get concerned, we get worried that our decisions are final, like we can't go back on them, and so we don't try new things because that's going to ruin my life. But there's
Hmm.
very few decisions that you make that you can't really walk back.
It's so true. I tell my daughter this all the time. I don't really believe in failure anymore. As
Yes.
long as you're trying things, I don't believe that anything is a mistake. I believe it's an experience. Try
Yes.
it out, gather the information, see how it feels to you, and then decide. So you're on the path, you go this way, feels good, keep going that way. Doesn't, reroute,
Right. You
just
learned a lesson.
recalibrate.
That way doesn't work, right?
That's right. That's not failure, it's just information.
So now,
So,
when you were dealing with burnout, did you get professional help? Did you work with a coach or a therapist, or how did you come up? Because there's a big leap that I'm missing somewhere in here. There's a big leap somewhere between endodontist and coach. So talk me through that leap.
so I will say I have had coaches over the years. I knew many, many years ago, when I first moved back to Maryland, that I wanted to have a life coach. So I had a life coach. I've had a
Mhm.
career coach because I did go through some questioning of, am I doing the right thing? I feel like there might be something else out there for me. I've had an executive coach, all very helpful. When I was going through the burnout, and I don't recommend this, but I kind of um, isolated myself.
Mhm. I think many people do.
I
Yeah.
just was trying to just make it through the day. So I really did not reach out. A lot of my family and friends didn't even know that I was going through it. I wrote the book and people read it and said, "Oh no, I'm so sorry. I had no idea all the things you were going through." But um, after I closed the practice, so after I had that conversation with my girls and then with my husband and closed the practice, um, I was actually at a graduation party for one of our friends' sons, and a good friend and sorority sister, Brianna, saw me and said, "Hey, how you doing?" And tried to put on the mask. Oh, I'm fine, you
Yeah.
know. And she kind of was like, she ended up calling me the next day and said, "Hey, sis, are you doing okay?" And I just,
Yeah.
broke down on
Yeah.
the phone. So she actually was, excuse me, the person who made me realize, like, I still need some support here. The
Mm-hmm.
practice is closed. I'm not completely burned out and overwhelmed, but I need some support. So I ended up going to a therapist. When I went to therapy, I think the biggest breakthrough that I had there was that I was extremely hard on myself.
Mm.
And she introduced me. I'd mentioned her in my book. I call her Doc. Doc introduced me to the concept of self compassion. And it really just changed how I related to myself, how I spoke to myself. And I just started telling people, anyone, anyone who I thought was being kind of hard on themselves, I'm like,
Yeah.
oh, you need to read this book, watch this TED talk, be kind to yourself, give yourself grace. And then I realized, um, Doc actually said to me in one of our sessions, I think you have a book in you. And I said, no, no, I'm not a writer. Like, no, my parents are authors. I'm not an author. And she said, no, you have a unique perspective. And so she kind of planted this seed. So once I was telling people about self compassion all the time, I said, I want to write a book for Black women. I think Black women were so phenomenal, so sharp, so hardworking, all the things, and so hard on ourselves.
Yes.
And we, just like what you were saying earlier, we don't celebrate our accomplishments as much as the mediocre
But you
folks
know
do.
what? But not only do we not celebrate, we even have this way of diminishing our accomplishments.
Downplaying.
Yeah, yeah.
Yes.
Like, oh, wasn't that much. It wasn't that big a
Yes.
deal. We
Yes.
definitely do that. And the other thing, too, is, you talked about, I'm backing up a little bit to something you said before about not sharing, with people that you kind of isolated. And I think that that's a
Mhm.
very common thing. And one of the reasons that I actually created the retreats and the work that I do, the Boss Lady Dream Builders, was because I would see these posts and women would be pouring out their heart. So they weren't exactly isolating, but they would always say at the end, please tell me I'm not the only one. Because we
Mm.
put on these masks and we put on the capes and we look so good doing it that
Mhm.
people think everybody else has it all together and I'm the only one who can't get it together. And
Yes.
so, it's like an embarrassment to admit that I feel like I'm failing everywhere, right?
Yes. All the places. I remember just feeling that, like, I'm working so hard, I'm so exhausted, and I still feel like I'm failing as a mom, as a wife, as a business owner.
Yes.
Um, but yeah, so I forgot where I was. What
Well,
was I
we
talking
were
about?
talking about the book, and about Black women, about, because I was
Oh,
saying that, yeah, that we do put on a good mask and cape and all that stuff.
yes, yes. So having that, just having the space, the mental space, I decided to write the book. So you had asked about support. I have had coaches. My therapist really, really helped me. Kind of after. Well, I guess it was still during the burnout, but it wasn't at the height of the burnout.
Hmm.
At the height of the burnout, I was pretty isolated. But she gave me some really good tools, and particularly self compassion. That changed me. It really did.
So, what have you found to be the response to the book, the impact from the book, from for those who've read it?
So this has been so wonderful. I wanted to share this, and particularly with Black women. So afterwards, I've had a lot of conversations. A lot of folks are really busy and I can tell that they've only read a little bit of it. Some of them now it's on Audible.
Hmm.
So that has helped because we're busy. I mean,
Yes.
I get it. I start reading a book, I fall asleep. Um, it's like, uh-oh. But I love Audible. I love listening to books. But once I started having conversations after the book was released, that's when I realized I really wanted to go a little deeper with the information that was in the book and present
Okay.
it in a different format. And
Okay.
so I decided to get my coaching certificate and decided to create a program where I could use the concepts from the book, self care, self compassion, and self love, in an anti burnout program that also has, a framework to get folks from burnout to balance. And so that's where I am now. It has been just beautiful to watch the transformations and the light bulbs going off.
Yes.
Um, I love having conversations with Black women, particularly about the book, about the information that's in the book. So yeah, it's really just been an amazing ride.
Awesome. So I know your framework is it P.L.A.N? It's plan,
Yes.
but it's an acronym. So tell us a little bit about that.
So it's the anti-burnout plan framework, PLAN. The P is for pause, the love, the L is for love, the A is for align, and the N is for no. So we start with pausing, and that is like breathing.
Hmm.
I wasn't
Yes.
breathing, which is why I think I had the panic attacks. I literally didn't take a deep breath for a year. So breathing and just taking some time to slow down, pause, breathe, and then reconnect with our core values. So once you know what your values are, like what is important to me, you can kind of filter your decisions about what you're going to
Yes.
do in your life based on your values. So that's the pause. Love is loving yourself and loving your life. So this is all about self compassion, self love, and creating a vision for your life that you will love. And knowing that you're worthy of
Yes.
having the life that you will love. And then the A is for align. So now we know what our values are, we know what our vision is, and now it's time to do the practical part. How are we going to design our lives in such a way that we're honoring our values, that we are honoring our vision, our priorities, the stuff that matters to us,
Yes.
not what everyone else wants, not what's important to everyone else and what they think we should do.
Right.
What do we want? So now we design our ideal daily schedule, kind of design our lives around what's important to us. And then the N is no, saying no, setting boundaries, saying no to others so that you can say yes to yourself. We actually create a no thank you list. And so at the end of this, they actually have a physical plan. In a book, they have
Hmm.
a values, vision, schedule, and a no thank you list. And they can go back and tweak.
Sure.
They can
Sure.
also do
Because
it
it changes.
digitally.
It
It
changes.
changes. You have different seasons of life. So your values when your kids are little might be one thing, and when you're an empty nester might be something else. So I love, love, love taking folks through the plan. I just finished maybe a week ago, did the last like finished the end of the plan with a fabulous client named Erica. She just sent me a testimonial, so I'll be posting that. But I loved watching the light bulb go off. I loved watching. It's not like life stops lifing when you're going through this plan. So she's still
Yes.
having, all kinds of challenges, all kinds of things, but now has a different way of even thinking about how to address the challenges, how to prioritize herself. So
Yes.
it's just been just really, really rewarding.
I love it. It's beautiful work. So tell us if we're
Thank you.
interested in if oh, you're very welcome. If we're interested in working with you, how do we do that?
The best way to reach me is just my website, kwelicarson.com, KWELICARSON.com. And there's a lot of different things on that website, but the best way is to set up a clarity call with me, where we can kind of talk through what is going on and what I might be able to help with, and I can walk through the plan. There are also some free resources. The book is on. This is my book, The Ultimate Self-Love Guide for Black Women. So the Amazon link is on there, but also there is an ebook link that's on there. And then there's also an anti-burnout guide. So some free resources, some paid things like my book, and then also clarity call. So whatever folks are, whatever feels right for them.
So now, are you doing group coaching and individual coaching, or just one or the
I
other?
am. I have done both. I don't have a date right now, but if for my next group, but if anyone is interested, I would love to talk to you, get you on a waiting list. I also do one-on-one coaching, so I'm happy to talk about that as well. And they can just reach out with um, schedule a clarity call with me.
Okay. All right. And we will definitely put all of those links in the show notes, but QuayleeCarson.com, right?
Yep, that's the best
Okay.
way.
All right. Perfect. And so, I want to know if there is a woman who is experiencing burnout or thinks she may be experiencing burnout, what's the single best thing she can do as a first step?
I think a lot of times we do not consider what is really happening to us. I think, similar, the ones of us who are high achievers, we put on our blinders, we're checking our boxes and just kind of going through the motions. So I think the first thing would be kind of, I hate to say my own plan, but the pause,
Yes.
to just stop, think about, what is really going on here? Am I actually doing well mentally? If not, book a call with a therapist. That might be a good first start. Um, you can also book a call with me to talk about actual burnout plan. But I think the first step is just acknowledging that you're having a tough time
Yes.
and knowing that it is okay to not be okay. A lot of us are having a tough time. And many times we are comparing our lives to what we're seeing.
Right.
And what we're
Yes, we are.
seeing is not always the truth.
Most of
Many
the time
times
it's
it's
not, right.
not.
We're comparing our lives to somebody else's highlight reel, right?
Exactly. Exactly. So I would say pause, and then do whatever is necessary to get you back on track. But really know that you do have some power and you do have
Yes.
some
Yes.
options. Because I think we do, you start to feel um, like this is going to be a permanent situation. And
Right.
oh, I just, depending on what you've done, I know a lot of physicians and dentists who have a lot of student loans and they
Hmm.
just feel locked in like, oh, there's
Right.
nothing that I'm going to be able to do. And that is not the truth.
Right.
That
It's a
is,
story.
that
It's a
is,
story we tell ourselves.
yes,
Yeah.
yes.
I know it. I know it all too well. That was the story that I told myself before I left
Hmm.
my practice. I said, "There's nothing else that I will ever be able to do that's going to pay these loans." But I didn't bother to investigate. Right? I never looked to see what other options might be. And so we have
Hmm.
to, be careful about those assumptions that we make because they may be holding us back from a beautiful life.
Absolutely. Absolutely. And one more thing I'll say about that. I think we are kind of all in people. And
Hmm.
so we're not used to dipping a toe in something and trying it out. So, another thing that is helpful to think about is that you don't have to just throw away your career and then just completely pivot to something different. You can make a small shift. You can use your transferable skills and do something where you're still using the knowledge that you have. You can
Yeah.
do a little side gig, like my expert witness work. You can do something and see, oh, well, that's interesting, or oh no, I don't like that either. But I think we are so used to being on this path that has all of the mile markers there for us. And so now
Right.
folks feel a little bit lost, like, well, what am I supposed to do next? And there's no supposed to do. It's
Yeah.
just
Yeah.
try it out and see what happens.
Yeah.
So
We're not used to going off script.
that's
And
right.
we don't know that we can actually write our own story. That's the bottom
Yes.
line. We do have a question in the comments for you. Somebody asked if you've spoken to dental students about these issues as a preventive measure for burnout.
So thank you for the question, Christy Hay, my link sister. So, Dr. Hay, yes, I actually have, not on a large scale though. I have spoken to, I have several mentees, and I have almost felt a little, um, it's a little sticky for me to talk to someone who's so excited about dentistry
Mhm.
and
Yeah.
then to tell my story to them. But I do talk to them about keeping their options open. I have been really real with a few of them. If they are really excited about it and they've had a lot of great experiences with it, I will get behind them 100%. If they are like, someone like me, just kind of put the blinders on and let me just check off the boxes, I'm like, hold on, pump your brakes. Take a
Hmm.
moment here before you commit to doing something if you're unsure. If you are as sure as you can be at that age, in that point
Right.
in your career, then go for it and I will help you in every way possible. So I have spoken to some individual dental students, but nothing on a larger scale. I think they do need to know about the potential for burnout, and so that's
Yes.
that's a good thought.
But then also, thinking about prevention a little bit. So even if because you chose to leave dentistry, I chose to mostly leave medicine, but at the same time, I think it's possible to navigate a burnout situation without actually changing careers.
I do
But
too.
you talk about self care, and so I think for that younger generation, because I don't know what it's like in dentistry, but I know in medicine, self-care was like a joke. Nobody talked about self-care. You didn't matter. Your self-care, what's
Yeah.
that? Every physical need we possibly could have, the need to eat, to sleep, to go to the bathroom, to drink water, all of it we were taught to ignore. So we were
Hmm.
never taught to consider ourselves. And so, when I talk to younger people, that's one of the things I say, that you matter. And it's important that you take time to check in with yourself and to do things to fill your cup as you go along
Yes.
the way. And maybe that might help you not to become burned out. Like if you're making constant assessments and adjustments as you go along, then I think, I'm not sure, but I think you're less likely to end up in those kinds of situations where you're completely overwhelmed.
Yes, and knowing that you should prioritize yourself. A lot of times we're so focused on taking care of other people, our patients, our families, or everybody else and everything else.
Yes.
but understanding that you are worthy of that same care and love and compassion and giving it to yourself, prioritizing yourself, taking the breaks that you need, drinking the water. I used to not drink water because I didn't want to have to take a
Right.
bathroom break. Like, that's crazy.
Exactly. Exactly. Well,
So,
thank you so much. It's been a pleasure talking with you. I appreciate your time. I appreciate the work that you're doing. Keep it up. Keep inspiring women, especially Black women, to love ourselves and to put ourselves, on our priority list. We may not always be able to be
absolutely.
first, but we should at least be on the list.
Absolutely. Absolutely. Thank you so much for having me, Dr. Sharita.
You're very welcome. Thank you guys for joining us and for your questions and your comments. We really appreciate you being with us tonight. Again, if you have questions that you think of later for Dr. Kweli, put them in the comments. I'm happy to forward them to her, and I'm sure she's happy to answer them. And again, just one more reminder that registration is open for a weekend for me, happening in Grand Cayman, October 2nd through the 5th. www.aweekendforme.com for more information. And I will see you all next week. Take care.